Okay, this is your review on the fluid and electrolytes part. Also, we'll talk about the acid-base imbalances just briefly. Mainly for that, I want you to make sure that you can interpret the numbers. Use the booklet that I gave you on interpreting acid-base imbalances. I think that'll probably be very helpful. Make sure you go over that, and then if you still have trouble with it, you can't understand it, you want to talk to me about it, then please feel free to make an appointment with me. I know I've got a lot of availability next week, both Monday and Wednesday, to help anybody that still feels like they don't understand how to interpret ABGs. So remember, on this lecture, I put up two parts, part 1 and part 2. The test questions are going to come from part 2. Part 1 was important so that you would understand the background information regarding fluid imbalances and how the different types of IV fluids affect cells in the body. So go back and review that information. I'm going to just kind of skip through here and focus on some of the highlights that you need to be aware of. You need to know the difference between hypovolemia and hypervolemia and what some of those signs and symptoms would be. Remember, when a patient has lost fluid, say they've had an injury of some type or a severe draining wound, or they've had vomiting and diarrhea, or they're not drinking, they are hypovolemic, or they low in volume. So what are some of the signs and symptoms that go with being hypovolemic? You're going to probably see a rapid, weak pulse. One thing that's very concerning is blood pressure can become so low that the patient could actually go into shock. If the blood pressure is low, they are not being perfused. Their tissues are not being perfused. And so you'll see that in your capillary refill. It will be sluggish. Respirations will be increased. Skin turgor will be poor. They'll be tenting. You can look at their mouth and their tongue may be dry. Also, they may have increased hematocrit because it is concentrated because of lack of volume. Fluid volume excess is hypervolemia, and this can occur because of excess intake of fluids, abnormal retention of fluids, or an interstitial to plasma fluid shift. So the clinical manifestations that you're going to see from having too much fluid would be the bounding pulse, the increased blood pressure. Patient may have a headache because of increased pressure in the brain. You may have the cells of the brain even swelling, causing pressure and headaches. It can affect their, as again, pulse, bounding, blood pressure increased. They may be peeing a lot if they have normal renal function, but if they have issues with renal function, they may not be able to pee enough. Lung findings are very important with this. They may exhibit shortness of breath, shortness of air, crackles, pulmonary edema, which is another type of third spacing. Weight gain, they've gained, several pounds quickly. So those are some of the things you'll see with hypervolemia. So here, side by side, look over these signs and symptoms and what they mean. Daily weights is the most accurate method of monitoring fluid volume. So if somebody's gained a couple pounds, in the past month, that's not a big deal. But if they've gained 3 or 4 pounds in a day or two, that could be a very big deal. So make sure you're getting accurate daily weights. So looking at the different type of electrolyte imbalances, on your study guide that I gave you to complete the day that we didn't have class. That is in Blackboard. If you didn't complete that, please do so. The information comes right from the reading. So as you're reading, go through and fill in the blanks. This will be helpful to you as you prepare for the exam. I know that one of the problems with trying to keep the signs and symptoms of the different electrolyte imbalances straight is that there's so many different symptoms and they overlap with other symptoms, and that's why the study guide has little hints for you. Like with sodium, it says think brain. Either high or low sodium can cause level of consciousness changes, and that's what I want you to focus on when it comes to sodium. Okay, think brain, think level of consciousness changes. So here it is, hypernatremia, maybe thirsty, but remember what I said about elderly people, they lose their thirst drive, so they may not feel thirsty. Alterations in mental status, that's the big one, and that may range from agitation, restlessness, confusion. It may even advance to seizures and coma. So some of the things that we would do, there's different causes of hypernatremia. It could be that there's a concentration of sodium in relation to how much fluid is on board. So then we're going to need to replace fluid, either orally or with a isotonic type of fluid, maybe hypotonic. Excess sodium, we're going to dilute with sodium-free IV fluids and try to get water, or try to excrete that sodium by possibly giving diuretics. Speaking of diuretics, make sure that you know the difference in the potassium sparing and the potassium wasting diuretics, or the loop diuretics such as furosemide, brand name is Lasix. Remember that with Lasix, patients are going to lose potassium. With the potassium sparing diuretics, they're going to hold on to potassium. So those people are going to be at risk of having too much potassium and becoming hyperkalemic. So again, make sure that you have memorized your electrolyte normal ranges. If the problem is not enough sodium, hyponatremia, we may need to replace that sodium with the IV fluid that contains sodium, such as 3% saline or 3% normal saline. However, this is going to be limited. We're going to have to really be watching for lung sounds if we are running a hypertonic solution like that. So with your hyperkalemia, make sure that you know the difference between hypo and hyperkalemia. With this in your study guide, if you look at that, it says to think heart or think cardiac, because potassium has a big impact on EKG changes, and that's in your textbook. You don't have to memorize, specifically what it does to the T waves. Just know that EKG abnormalities is the big one with the potassium imbalances. So there it is, manifestations for hyperkalemia, cardiac dysrhythmias. That's the big one I want you to focus on. If we have too much potassium on board, we're going to teach the patient to avoid things that contain extra potassium. Certain fruits like orange juice is high in potassium. Salt replacements are high in potassium. So we're going to teach them to avoid those things. Avocados are also high in potassium. And then we may need to give diuretics to help them pee that off. And we talked about Kexalate. That can be either an oral or a rectal administration that binds with that potassium and pulls it out. Now we have hypokalemia. Once again, cardiac. Focus on cardiac for the hypo or hyperkalemias. Remember safety with potassium. Review the safety issues regarding potassium. Calcium, I want you to think about the video that I showed you and the different tests for hypocalcemia in particular. Make sure you know what the Kvotec and the Trousseau sign are and what they mean. With hypokalemia, there will be like numbness and tingling, maybe around the mouth and in extremities. Make sure you remember that. With the hypo, I want you to think hyper reflexes, so hyperactive reflexes. Whereas with the hypercalcemia, what is that going to do to the reflexes? It's going to depress the muscle reflexes. So with hyper, it is depressed reflexes. With hypocalcemia, it is hyper reflexes, hyperactive reflexes, and that numbness and tingling, and the Kvotec sign and Trousseau's. So look those up if you can't remember what those are and how to do them. Go back and review the hypo and hyperphosphate. Those are in your textbook in that little chart. Magnesium, look at that. What I want you to remember as far as clinical manifestations of hypermagnesemia is diminished deep tendon reflexes, and they're going to have lethargy and drowsiness. With the hypomagnesemia, they're going to have hyperactive deep tendon reflexes. This sounds very similar to the calcium issues, but I want you to tie it in with as far as hypermagnesemia, they're going to have diminished deep tendon reflexes. Add to that drowsiness and muscle weakness. And that will help you to distinguish it from the calcium. And the hypomagnesemia, hyperactive deep tendon reflexes and muscle cramps. Add to that muscle cramps. So put those two together with the hypomagnesemia. Focus on those particular symptoms so that you're not having to go through a whole list and try to figure out which to remember. So with hypermagnesemia, diminished deep tendon reflexes and muscle weakness, drowsiness. With hypomagnesemia, hyperactive deep tendon reflexes and muscle cramps. And make sure, of course, that you go back, look at the objectives at the beginning of the chapter. Ask yourself if you have an understanding. When I lecture, I teach to the objectives, and then go through and focus on certain points that you're going to need to know for the exam, and things that I really feel like are important for you to know. But make sure that you go back through and look at the objectives, which are posted for you. They're in your textbook, and of course they're also posted under the course content tab. So we talked about different types of fluids, the isotonic, hypertonic, and hypotonic. They are all listed for you in your study guide. Also, they're found on page 293 of your textbook. So you want to know how those work, and just briefly, the hypotonic fluid has more water than electrolytes. So water is going to move into the cells.